Hello, Nicolle and Jacqui. I am really excited to talk about some really important things that we get questions about in our email inbox, and we talk about a lot as a team, and some myths we try and dispel in the field in general. So let's just jump in. I know both of you work with people that we put in this category that we call transient populations. So first, let's talk about what is that? Who are the people that are in transient populations? What are their situations or circumstances? And then how do we work with them? With EMDR therapy in general, with the assist, with the Pressy, the IGTP. Yeah, sound good? All right, let's do it. What's a transient population? What does that mean? Who are those folks?
You want to go first? Or you
Sure, you can go first.
Okay. Well, I think transient really basically means like in transit, right? It's movement. And so the transient population that I work with is very literal in that sense because they are migrating. So I live in Mexico City and I work at a refugee shelter here. So it's basically I work with people who would be considered refugees, migrants, and asylum seekers. So they're in transit, they're moving.
Yeah, I think the population I work with is a little bit different. I'm located in Philadelphia, which is, the poorest of the large cities in the country. And for us, transient really is, I'm trying to think of the right words, but I would say displaced. I think another word for transient would be also displaced, whether it's from gentrification, whether it's from systemic oppression, carceral systems. It looks really different. For instance, I work with specifically the incarcerated population is a niche of mine. And even though people may have had a very stable home and environment as far as like being housed, when they sometimes get caught up in the systems, they lose everything. Even if later on the cases drop, there's, that they were innocent in so many cases, they're held captive within systems that we have, and they lose their jobs, they lose their homes, they lose their families. Children are taken away. So when I think of transient, I also think about like within a community population, within community settings, it's whether it's the individual themselves being displaced, moved, in some instances kidnapped from their communities that they love, as well as the ripple effect, whether it's their children, their other loved ones that are all impacted as well. So for me, transient really, I think, connects a little bit more within just our systems, and how our systems have so much control over where we are and how we show up, and how then that is such an impact on where we live, and also our bodies, literally our bodies, and also the limbic system that's connected to the body.
Yeah, and often we're taught or cautioned against working with certain types of folks, and I imagine transient populations, folks in that population would fall under that. We can't do EMDR with those people in those experiences or with those circumstances. And there's many other kind of myths around who we're not supposed to work with. And I would love to talk a little bit about that, because I know just from some side conversations we've been having that this is a big focus of your work, and part of our mission with scaling up around alleviating human suffering, and how we do that with various trauma interventions. We have to then think about how do we reach folks that typically don't have access, or they're systemically barred from access, or we're taught we can't do EMDR with these folks. We can't do deep healing work with transient people. So tell us about that. How do you approach that? How do you shatter that?
Ooh.
I know, big.
I've got to notice where I feel that in my body. I think the first thing is anytime someone says who you can't work with, that's typically a clue to me that there's some fear that they have within their own bodies about maybe their capacity, right? Because when we're talking about some of these populations that both of us work with, they're really tough situations, they're really tough cases, and that could be scary to therapists, no matter how much experience they have. And what I often hear is, it's almost like we can't work with them almost as a scapegoat, because it makes it easier, right? It takes the blame off of me of needing additional training or additional supports. And I can't possibly need more. It's just that we can't do it with these populations. So I think a lot of it is based within fear and just not knowing, as well as not enough of these conversations about what we can do. Because I know, like, even with myself, I go into, the jails. So that is a very transient population if you look at it in those terms. And I'm able to create a space that's safe enough for people to be able to connect and to begin their healing journey. Whereas in a lot of trainings, you hear people with years of experience saying that you have to wait until someone is stable, until there's a better time. And I don't believe that. I think that any time is the right time. Any time at all, and in any place that you meet people, if you have resources and tools, how dare us not be able to meet people where they truly are? Isn't that part of our ethics? Meeting people where they are with this unconditional, positive regard. But I don't know if everyone actually understands what that means. And I think that's the difference in the work that we do, of really meeting people where they are.
And I think, it begs the question when we talk about we can't work with people until they're stable. It begs the question of who's defining stability, and how can we predict how long that stability will be around? And what if their inner instability can be alleviated by getting the proper mental health support that they need?
Just being seen.
Just being seen.
I think it's really interesting that you say that about stability, because literally in one of the S's in the ASSIST acronym is stabilization. And it is the purpose, one of the objectives is to regulate or stabilize the nervous system. And with the populations that we work with, there might not really ever be what would be considered stability. Because there are people, part of being transient populations is that there is a lack of stability because they're in transit, because they are in this transition or they're in transit. And so I think it's really interesting. I've heard that so many times from people where they have said that, that certain people or certain populations, they're not ready. They can't get EMDR, they can't receive EMDR therapy because they're not stable enough and they're not ready. And I heard this quote that I love that was like, sometimes the most stabilizing thing you can do is the EMDR therapy. And I think that's so true, and especially with the suite of protocols and treatment interventions that we have, that the trainings that we provide at Scaling Up, they really are designed to work with people in situations when they're really suffering and they don't have stability. The IGTP we've talked about this a few times, the IGTP was developed in the sand under a mango tree after, I don't remember exact, I think it was within 3 months after the hurricane. And then the work that we do, I have worked with people at the refugee shelter that I work at where they just got released from a kidnapping the day before, and they still have, I'm like, okay, go to the hospital, get your injuries checked out, make sure you're physically safe. But then, because if we don't work with them as quickly as possible, if we don't intervene early enough, just literally the part of early intervention, their symptoms are gonna get worse, their functioning is going to deteriorate further, and it's actually going to exacerbate their instability. And really, if we can get them stable psychologically, physiologically, emotionally, they have a much better chance of reaching these other types of stability that we see as barriers to providing treatment.
I think the word that came up as you were talking was the idea of being disenfranchised. That there's, even within our fields, just the way that it's set up, that it's inaccessible to so many people. Yeah, so that definitely came up. And the other piece around healing, when we're looking at the assist, when we're looking at these group protocols, what people need is connection. And that's what you get. You get connection. And I think the difference with this suite of protocols, it's really done from a humanistic standpoint. Mm-hmm. Like it's me, it's the client, or it's the clients, right? Like this population's community, but it's community work. This is like, you know, individual and group connection on such a deeper level, where the person who has experienced whatever they've experienced really truly gets to lead. Like we listen to not just their voice, but we're listening to their bodies. Mm-hmm. And we're allowing their bodies to just, and not even saying allowing, right? I want to take that out of our vocabulary, but creating this space. We're intentionally creating space that people can feel all the feels. And it's beautiful, right? To be able to feel, to be acknowledged, to be validated, to be heard, and to be held.
Yeah.
I think that's the difference.
Totally. And I don't want to, I when I say this, adding to that, I don't want to disregard the importance of preparation and stability and making sure that somebody is appropriate for EMDR therapy. But I do want to say that I think by being afraid of people's reactions, which are really just normal responses to abnormal situations, and I think by almost withholding treatment because we're afraid that they're not stable enough, that they're not going to be able to handle it, it's really invalidating to their resiliency and their actual capacity to not only have survived the experience that they experienced in the past, what they're dealing with in the future, but also to manage the best that they have in those very unstable situations. I think it's super invalidating, and it doesn't give people enough credit for what they've been able to handle and that they can handle the reprocessing. And there's another quote that is actually in the latest edition of the EMDR book, the Francine's book, that's like, I don't remember the word for word, but it's basically like, if you can't handle other people's distress, don't be an EMDR therapist. Do something else. Like, go be a yoga teacher. Like, do art therapy or something. Those are all fine and those are very helpful. But do not be an EMDR therapist. And so I think that waiting for people to be stable enough or to see if they can handle it can be really counterproductive and detrimental, and really the opposite of what we're trying to do.
Exactly, and it can create, a wider or a more impactful power dynamic between you as the therapist and the client, deciding, the stability levels and if you're appropriate for this, right? And widening this gap that creates more tension between us, like two people.
Yeah.
And being able to provide an approach to trauma care that is honoring of the amazing capabilities that our clients do have in navigating these incredibly destabilizing, dehumanizing, harmful, hurtful, stressful experiences that our clients have. And to expect for them to have a certain type of stability that is impossible in their circumstances.
I want to, like, even piggybacking on even the validation, I think to even take it further, that is not just invalidating, it is intentionally oppressive.
Yes.
Mm-hmm. I am going to decide for you if you are ready, rather than me recognizing that maybe I'm not ready.
Yeah.
It may not be, and I always say, like when I'm working with, consultees and trainees, that if you're not sure and you're thinking that the client isn't ready, you really need to check your own nervous system first. Because oftentimes there's something else that's coming up, as well as, for me, looking at even like a system, when we're thinking about like making sure that people are appropriate, I liken it to, are we trying to make sure that people are appropriate to heal? Like who gets to make those decisions? And using something like the assist, where we are stabilizing the limbic system, we're giving people options and opportunities for them to be the best versions of themselves. We don't get to choose. We don't get to choose, nor should we ever decide. People get to decide what they want to do. Yeah, and I love that with Shapiro, with like, yeah, if this is too much, then you need to do something else. But art therapy isn't one of them. As a somatic therapist and an art therapist,
get out of the kitchen.
Just get out of the kitchen.
Yeah.
But don't do art therapy. Don't do that. Because again, I think that, all of these things that we're doing are somatic practices. We're looking at people to go inward, and some of those creative expressions and just really being able to sit in our bodies. And I think that's what's so special about these suites, that I think in so many of the other protocols, they're very rigid. They're very rigid, especially if the way people are going to read them the way that they're written, which in and of themselves can be off-putting to the nervous system. Whereas in here, like having someone really be in control, in charge, and they tell you what it is they want to work on. They tell you how they want to approach it. It's so empowering. Versus some of the opposite of what I see is, kind of that invalidating, you can't do this, we let the symptoms increase, as you said, and then we pathologize everyone, right? So it's like setting people up to pathologize them rather than literally just create space and be human and see what happens, right? There's nothing that can go wrong when you are showing up in your fullness and you're just connecting. And then we see where it goes. And I think that's the difference with this suite. The way that people are trained within this trainings, that's what we center. Yeah. We center you being present, you constantly, like that floating attention. Our clients, we're there for our clients. And we also need to make sure that we're settled, because their bodies need to be regulated, connected to ours, and we can't have chaos going on inside.